Hi, my name's Larry Mock. It's June 16th, and 4 days ago I had a acoustic neuroma removed from my skull, and just want to get some words down here. And I've looked on the internet and I've seen a bunch of people putting videos up there, and a lot of them were kind of depressing, I guess you'd call them. There's bad outcomes. I had a pretty good outcome. So 4 days ago it was removed, and just kind of wanted to go over the history of what happened and when it happened and all that stuff. So bear with me a little bit. On May 3rd, I was driving to Dallas, and I kind of had some weird feelings, and it was kind of describe it as like when you're going to sleep and you wake up, all of a sudden it was kind of that like I was actually falling asleep at the wheel or something. And I pulled over and had some coffee and ate some stuff and went on down the road. And when I got to Dallas, I called my wife, and I was talking to her on the phone, and I had to change ears for some reason, and I realized I couldn't hear in my left ear. So didn't really know what was going on, so I called my general practitioner, and he referred me to a ENT, Dr. Thomas Nowlin, and he said it could be a virus or a tumor. So he prescribed antivirals and a steroid, and also an MRI. So I went back to and also went back to Dr. Nowlin for a injection of steroids behind the eardrum. But after some miscommunication and whatnot, I finally went and got the MRI, and it came back with this diagnosis. I'm going to read this. It's IAC and CP angle. An avidly enhancing extra-axial mass is centered within the left internal auditory canal, compatible with a schwannoma. This measures an estimated 14 by 14 by 22 millimeters. This involves essentially the entire length of the internal auditory canal with slight widening. The largest portion of the mass is centered in the cerebellopontine angle, with slight displacement of the adjacent brainstem. The most medial aspect of the lesion appears to be cystic. The 7th and 8th nerve complex cannot be distinguished from this lesion. This does not extend into the labyrinth. The contralateral internal auditory canal, labyrinth, and vestibular audiomatic pathways are normal. Inner ear structures. No abnormal inner ear enhancement is found. No abnormal facial nerve enhancement is seen. Brain. No evidence of ischemia, hemorrhage, mass, or midline shift. No extra-axial fluid collections are identified. Vascular. Major arterial venous flow voids are well preserved. Calvarium orbits and skull base within normal limits. Cerebellar tonsils are normally positioned. Sinuses and extracranial structures within normal limits. Sounded pretty good, huh? The findings: compatible with vestibular schwannoma within the left internal auditory canal and cerebellopontine angle, measuring up to 22 millimeters. There is very slight mass effect on the adjacent brainstem. So basically I was diagnosed on March 26th. My surgery was done on June 12th, so it took a while to get this all together. The night after the surgery was obviously the worst. I stayed up all night long and they were pumping me up with stuff and putting all kinds of blood pressure stuff on me all night long, and I was all confused, and it was just it was actually pretty funny actually. But I could see double, but it wasn't double like there was a clock. I was looking at the clock, there was a clock over here and a clock over here. There was one clock here and one clock overlapping up here, so it wasn't like you were just crossing your eyes. And they kept on asking me to do stuff like smile. So I still really can't smile too good. And my eyebrows, if I move my eyebrows up and down, can't really do that, both sides. When I blink, I have to actually kind of physically blink this. It's not really automatic, so if I blink automatically with this right eye, the left eye doesn't go. I have to kind of squeeze it down for the left eye. I have some sensation in my mouth. When I eat, it's hard to get the food moving around a little bit, but they said that all that would go away. The other thing was, right after I got out of surgery, all this stuff worked perfectly. I mean, my eyebrows were moving, everything was working. So they say that there's some swelling in there, and once that goes down, the nerve will start working again, I hope. So I don't know how long that takes. They don't know how long it takes, so I just have to wait it out. Okay, let's see if we can see this scar. I haven't had my hair washed, but I don't know if you can see that or not. I'm having a few headaches, so if you have one of these things done, go ahead and keep your medication coming in. I'm taking Narco, which is Tylenol and codeine, I think. And then I'm on a steroid taper, and they gave me some Valium to try to help me go to sleep, because the steroids are, it's hard for me to go to sleep with those steroids. Anyway, 4 days afterwards, and hey, I look pretty good, right? All right. Hey, I want to thank my wife, especially Tracy, for helping me out in this whole situation. She was really the most help of anybody, I think. And you know, kind of just everything I needed, she was there to help me. You know, my kids and my sister Michelle, for kind of staying at the house, keeping the kids, moving them around, letting them have fun while I was in the hospital. Also Dr. Slater, my ENT, he's kind of a character, and Dr. Kemper, who's my neurologist, kind of kept everything together. And especially those ICU nurses, Ashley, thank you, and Sarah during the day. Really great help from you guys. And Seton Hospital, it's a great hospital. If you ever need to have something like this done, Seton's a great place to do it. And all my neighbors who have been keeping me in their thoughts and prayers. So, thanks a lot, guys.